Good afternoon, class. I am your teacher for the subject Principles of Teaching in Medical Technology Sciences. I am Miss Beltran, and today we will be having our first lesson. Our first lesson would be our hand washing and our donning and doffing. So before we start, do anyone of you have encountered hand washing and donning and doffing?
Yes, ma'am.
Okay. So Mr.
Yes,
Coremo, you
miss.
answered yes. Do you know when we need to wash our hands in the laboratory setting?
If we collect blood,
Okay, that is correct. When we are collecting blood, we also need to wash our hands for safety purposes. So moving on. So hand hygiene and PPE, they are crucial in our healthcare for infection prevention. So hand washing defends against infection, while our PPE protects both the patient and us healthcare workers. So this lesson explores the key role these practices play in patient safety, infection control, and healthcare worker well-being. So the objectives for our class, we have three. Number one would be to discuss the importance of hand hygiene thoroughly. Number two, we have to explain the importance of PPE thoroughly. And then the demonstration of hand washing, donning, and doffing of our PPEs correctly. So before we start, do any one of you know what is in the picture? Do you recognize it?
yes, ma'am.
Yes, ma'am.
Ano naman siya?
Gloves.
Sterile gloves.
Oh, correct. Gloves. Asa man suot ng gloves?
Kamot.
Oh, syempre, takamot yun. Correct. Next, kani, unsa man ni?
Lab gown.
Lab gown.
Gown. Ang lab gown, suoton sa gawa sa laboratory.
Dili.
Dili.
Asa man day suoton?
Sa
Laboratory.
Wait, gid mo class. O, kani, last, unsa man ni?
Was.
Mask.
Face mask.
After ni mo hubos sa imo face mask, imo, kuano tro, itawad otro.
Dili.
O, right, yun si Mañacap. Okay. So, materials and equipment. And then manani, our hand washing. How do we wash our hands properly? So this is our source. Kay gikan ni siya sa World Health Organization and also our PMLS lab manual. So Mr. Collado, can you please read?
Hand washing. Hand hygiene is the first line of defense. All health professionals who are in direct and indirect contact with patients and their environment must be responsible for reducing microbial transmission by performing proper hand hygiene. Routine hand washing is 1-minute procedure that is generally considered to be the single most important method for preventing the spread of infection.
Thank you, Mr. Collado. So unsa ganito, unsay first line of defense nato?
Hand washing.
Ang hand hygiene.
Okay, na step 1, wet hand with water. Ang importante kay dapat dili mo pilit ang atong lawas sa lababo. Step 2, apply a soap and work up a lather. 3, hey, rub hands palm to palm. Ipakita daw unsaon pag ana. Unsaon pag rub hands palm to palm? Correct. Rub right palm over the left dorsum with interlaced fingers and vice versa. Unsaon daw? Ipakita. Ana. Correct. Right, good mo class. Kanin, step 5, rub palm to palm with fingers interlaced. Step 6, rub back of the fingers. Ani. So, more siya nag-Maria Clara pose. Ana. And then 7, rotational rubbing of left thumb, clasp in right palm, and vice versa. And then step 8, kay rotational rubbing sa back. So ang kani fingers kay i-rub siya sa palm. And then i-rinse dayon nato to hand with running water in downward motion. Then mag-dry hands gamit ang paper towel. Then ang paper towel ang igamit pag off sa faucet. Nga naman.
Para dili
Para dili ba-
Mabalik
Sa
ang
Mr. Coremo,
para dili ma-contaminated balik ang kamot after washing.
correct. So mag-watch siya taog video nga na proper demonstration. Okay, so mo na to class ang atong proper hand washing. So kato kay gikan siya sa World Health Organization nga guidelines. So human na ta hand washing, move on na ta sa donning and doffing sa atong PPE. Kinsa na may kibaw mo don og doff sa ilang PPE? Wala pa yung nakabalo pag donning and doffing sa PPE. O sige,
Si
makatlag sa
Harvey.
karon.
Wala, oy.
So, donning and doffing of PPE. Mr. Gonzales, pakibasa.
Donning and doffing of PPE. Personal protective equipment acts as a barrier between infectious materials and your skin and mucous membranes. To minimize the spread of infection, PPE must be properly worn, done, removed, doffed, and disposed of. These procedures are essential to protect individuals from exposure to hazardous materials and maintain a secure working environment.
Thank you, Mr. Gonzales. So, step 1, kay lab gown. Pinakauna na to i-don ang lab gown. Next, kay ang mask. After sa mask, unsa may after sa mask?
Nernet.
Unsa?
Nernet.
Ay,
Ang
Nernet.
atong gloves. Atong
Gloves.
memorization kay GMG. Gown, mask, gloves.
Mask,
GMG.
gloves.
Team July.
And then sa doffing, kay gloves, gown, mask. Di ba sa donning kay gown, mask, gloves, GMG. Ang sa doffing, kay gloves, gown, mask, GGM. GMG, GGM. Kanala i-memorize. O nya, mag-watch na sa taog video unsaon pag properly don and doff sa atong PPE.
Now for donning and doffing. So if you ever get confused, remove the D's and it's just on and off for your PPE. So to keep it super simple, we only have 4 elements. First things first is the gown for donning or putting stuff on. So Kat here is going to demonstrate. All right, now for the handy dandy mask, always blue side out if you're a surgical mask. We can also have a N95 as well. And the next thing is the fun part, the goggles, or in this case, a face shield. So we can also have some fancy surgical goggles. Now the last one is the glove here. Now, one of the biggest points and the key point takeaway is the gloves over the ends of the sleeves here for the gown. So We want to make sure that we're aseptic. We don't want anything leaking into there. If anything gets splashed on us, we want it to be on the outside. Now it's time to doff, or basically take things off. So if we're looking at cats, the first things first, we're removing the gloves. So taking those gloves off. Then next, after the
So anong gloves man ang una na to i-remove, guys?
Mamay pinaka-contaminated.
Correct.
Expose
So
kayo.
ako tong pinakauna i-remove kay ang gloves. Sakto si Mr. Coremo kay may pinaka-contaminated.
gloves is the face shields, or the goggles here. Next thing is the gown. So look closely at Kat's hands here, because we want to maintain aseptic technique. We are trying not to get our hands dirty because they're exposed, and keeping it on the inside of the gown. So we're going from the neck area and pulling out there just to perfectly try to keep it clean. And then once we're out of the patient's room, if they have a airborne disease, we're going to be taking the mask off with some clean hands.
So muna to, guys. Unsa gani ang una nga isuot ang
Gown.
ang sunod?
Gown.
Mask.
Mask.
Gloves.
Correct.
Gloves.
Gloves. Uy, na-loading si Mr. Gonzales. O, ang pinakauna kuhaon, ang pinaka-contaminated, unsa man?
Gloves.
Ang sunod,
Gown.
lastly,
Mask.
correct. Mupasar na gid mo, bright gid mo. Okay, next, guys. Human atong lesson. Yay!
Yay!
Pero
Attendance.
naay assignment.
Day.
Pero before ang assignment, mag-attendance ako, Mr. Collado,
Present, ma'am.
Mr. Coremo,
Present.
Mr. Gonzales,
Present, miss.
Mañacap.
Present, miss.
Okay, perfect attendance. So karon move on na ta sa atong assignment. So for our assignment, duha ra gyud ka question inyong i-answer. Number 1, what is PPE and why is it important? And then number 2, briefly describe the steps of proper hand washing. Isabit ni ninyo nako kay sa next nato nga lesson. So napay pangutana?
Wala na, miss.
None.
Wala, miss.
Yes, miss.
Okay, so that's it, guys. Humana atong klase. See you guys next week for our lesson. Thank you all.
Thank you,
Yeah.
miss. Bye.
Bye-bye.